was speaking at an event that the foundation was having, and afterwards Patrice Kelly came up to me and I was talking about our work with the schools and the obesity epidemic and the importance of getting healthy fruits and vegetables and proper nutrition to the community. And she approached me and she said, wouldn't it be wonderful to use the space across the street from the hospital's emergency room for a garden? Could we get permission to do that? And I said, I don't know, I'll find out.
Pam Scott at the foundation helped, or has worked with me as a liaison to the hospital executives, and they made a decision. Yes, they would go with the idea that we had, which is to start a community garden, and we would keep it limited to 16 raised beds, which are 24 feet long and 4 feet wide, and that we would begin to grow organic vegetables in soil that was brought in, fresh soil. The organic vegetables would be distributed at 4 local soup kitchens in the Montclair and Greenfield area.
For this garden, raised beds were the best choice because the land that we're doing the garden on was previously several homes, and we didn't really want to start digging up rubble and things like that. We didn't know if the soil was contaminated. We figured it was best to just start with fresh organic soil in the raised beds. Also, it's easier for handicap accessibility for the people who want to come to the garden and work in the garden. It's easier on their backs. We have 2 raised beds that are actually handicap accessible, and it's easier to work soil that way.
We had to mix the organic soil, which is a combination of topsoil, peat moss, and some composting materials, which basically are dried cow manure. The
companion plantings we did, we added plants and vegetables and herbs that would benefit each other. We're also rotating crops so that when one plant is finished, like early season crops like lettuce and peas, then we come back with something else that the nutrients that are left in the soil from the peas and the beans and things like that will provide necessary nutrients for the following plants. So we get maximum yield that way. We don't have to use fertilizers. It's all organic. And each of the plants, as they succeed in the planting, benefit the next crop coming up.
Pantry Partners is a program that's funded by the foundation. It was started last year, and it's designed to bring mental health and social services information out to our food pantries and soup kitchens.
Pantry Partners is an initiative that we developed out of originally our efforts to address the needs of the community, the growing number of clients who are utilizing the soup kitchens because of the economic downturn.
Pantry Partners has a really wide catchment. There are about 12 food pantries and soup kitchens that are participating in Pantry Partners in the suburbs, and I would say roughly and literally thousands of clients and guests are being served by the food pantries and soup kitchens. And the largest food pantry here in the suburbs serves nearly 1,000 people every month.
It's time that we involve the people that tend to be marginalized in our communities and that we don't always see every day, and involve them in the practice of eating healthy food. And also too that they can just enjoy the fresh vegetables that we have. It's been a problem for a considerable amount of time now for people in lower income brackets to be able to afford fresh vegetables, and this makes it possible, at least for a portion of the community, to begin to experience what it's like again to taste fresh beans from the garden, fresh lettuce from the gardens, fresh tomatoes from the gardens as well.
In terms of the soup kitchens participating in a Lot to Grow community garden, there are 4 of those soup kitchens, and one of them serves 75 individuals every single day. And I should say, very importantly, there is a soup kitchen open 7 days a week locally. So that if you add that, you know, times 7, we're talking about hundreds of people just at soup kitchens every single week, hundreds and hundreds. So we really have, the pantries and soup kitchens have an enormously wide impact on residents of Essex County and nearby Passaic County.
And at the same time that we are growing the vegetables for the soup kitchens, we also have the garden open. It's open on Monday evenings from 6 until dusk, and on Thursday mornings from 8 until 10 a.m. wide open. But then we're often have the garden open when we're doing some additional work in there, and we invite people to come in.
There's something great about going there in the morning, working, and especially going with people that you know and friends. It gives you a chance to be working on something together, but also catching up with each other's lives.
I think it's when you go to the garden and you see the things growing and how abundant it is, and you see how much produce is coming out of just that one space and how many people are benefiting from that. It's really exciting, and if anybody wants to come down and volunteer and be a part of it, it's a great feeling.
It's inspiring, I think, for people to see others in the garden working, and it invites people to talk to you when you're in the garden, and you end up sharing stories together.
You know, you really get a sense of accomplishment from seeing things, you know, come from seed to, you know, beautiful produce that are providing great meals for, you know, people who wouldn't otherwise have that.